Hi everyone, I'm Coralie. Have you ever had the feeling of having someone else's life in your hands? Well, that's how it is being a nurse. You walk into work for a 12-hour shift and you have no idea how it's going to go. Being a nurse entails a lot of duties. You have to be very compassionate about the job and you have to be very dedicated. I'm going to just kind of talk to you about the typical nursing shift. So to start out, you give report. You'll take report from the day shift nurse or the night shift nurse, depending on what shift you're on. For me, I'm on night shift, so I would begin report from the day shift nurse. She's going to kind of give you a rundown of all the patients, things that happened during the day, what needs to change, what needs to happen, that kind of thing. So you can kind of get all of your thoughts and ideas together, make lists. That's how I typically get through my shifts. That's typically how a shift will start. Time management is super important. Being a nurse, you have time manners to get through things such as like lab collections, med passes, assessments, charting, that kind of stuff. Normally during the shift report, that's typically when patients need the most, it seems like, which obviously we don't mind doing it for them, but it kind of throws you behind already. So to start out the shift after the report, you will do your first assessment head to toe and also give meds if they have any. There are a lot of things that go unspoken during a 12-hour shift. And then after you do your assessment and med pass, you'll finally get to sit down to chart maybe for a little bit. And then after charting, you will typically begin another med pass, assessment, call a doctor, that kind of stuff. Just whatever the patient needs. So dedication is huge for being a nurse because we work holidays, we work when it snows, every day. The hospital is open 24/7. So we're there every day, and we care for the people while others are enjoying time with their families. And typically, the family members in the hospital are dealing with the worst times of their life. So as a nurse, it's your job to try to make that the best experience for them that you can. And sometimes that's a little bit difficult, trying to please people. It's a little bit different for me since I work on Mother Baby. Typically, it's a very happy environment, which is nice. Let's see. You also, as a nurse, have to be an educator. They rely on you to explain why they're getting the med, what the med does, and what it's for. So you have to be a very good teacher in explaining things on their level so they understand what is going into their body. You also have to be on good communication with the doctors. Nurses are the eyes because we're there at the bedside 12 hours out of the shift. So things change, the doctor relies on you. So that's a huge responsibility because if you miss one thing, a lot can go wrong. Let's see. We just deal with a lot. As a nurse, I love my job and I wouldn't ever want to do anything else, but sometimes we don't get the recognition I feel that we deserve sometimes, because we do. We deal with a lot during our 12-hour shifts, a lot of unspoken things that we're not even allowed to talk about. So, all right, thank you.